And welcome to the Dr. Bob Show. We'll be spending most of this show talking about gluten sensitivity. Gluten is a protein in wheat that can cause serious illness called celiac disease. But there are other people that go on gluten-free diets that it seems to help their grumpy stomach, their grumpy personality, their grumpy joints, or their grumpy mind. So does gluten-free diet help people that don't have celiac disease? We'll be talking about that. My guest is Dr. John Haydek. Dr. Haydek is a board-certified gastroenterologist, stomach specialist. He'll be answering our questions. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. If you don't like to go see the doctor, we'll be talking about red flags that are waving in front of you that tell you when you need to go see the doctor. And shingles, what causes it? How do we treat it? And can we prevent it? A lot of information for you. You'll want to stay tuned. We're talking with Dr. John Haydek, board-certified gastroenterologist, and we're going to be talking about celiac disease, gluten sensitivity. John, welcome to the Dr.
Hi,
Bob
Dr.
Show.
Bob. Good evening.
Tell me, all I hear about is gluten-free foods and gluten sensitivity and gluten-free diets. What is gluten?
Gluten is a protein we find in some foods like wheat, rye, and barley. And it's just a breakdown product that most people have no problem digesting it like any other protein. But there are some people with a genetic abnormality called celiac disease or a vague symptom or disease called non-celiac gluten sensitivity that can cause them trouble.
So it seems to be there's a pathway that two people go. Tell me about, if you've got celiac disease, that means the gluten is causing an illness. Is that right?
That's correct. The gluten is actually causing an abnormal inflammatory response, almost like a bad sunburn of your intestines.
What part of the intestines?
The small intestine, usually the first portion, the duodenum.
The duodenum. So what is the purpose of the small intestine as far as gluten causing an illness on it? Where does it interfere?
Well, our small intestine, this beginning portion, have these long fingers we call villi, and they help absorb your nutrients all throughout those fingers. But when gluten causes inflammation, those fingers become blunted because of all the inflammation. And if you can just imagine, you're not going to absorb all the nutrients because your fingers in the intestines are blunted, and therefore you don't absorb them. So where do they go? Well, they go into your colon. The bacteria in your colon just love all those nutrients. And patients with celiac disease will then get signs of bowel change, diarrhea, maybe constipation, gas, bloating, irritability in there.
Is it a common thing? I've heard that it's much more common than people realize.
Well, it is a common thing. It's just most patients tend to have mild symptoms and they think they just have gas or they think they just have irritable bowel syndrome. But we quote about 1 in 200 or 1 in 250 people have celiac disease.
That's pretty common. That's pretty common. So if somebody has celiac disease, their GI tract, the small intestine, is not working well, you can't absorb stuff, diarrhea should be more common, is it?
Well, I would say bowel change. I don't want to say diarrhea because it's all a degree of how severe it is. If it's very severe, yes, they will have diarrhea, weight loss, no appetite, they'll feel terrible. However, some people with very mild changes will get bowel change. Some kids will just get constipated, not having diarrhea. But it's the gas and the fullness and the overall picture.
Is this an autoimmune illness?
It's an inflammatory illness, not really autoimmune. I think the gluten or protein is combining with the abnormal genes in the intestines so that your body recognizes that area as abnormal, and then your body attacks it like anything else.
How do you make the diagnosis?
Well, usually it's a combination of symptoms, blood work, and then a scope test, which nowadays can be performed almost painlessly, looking at the duodenum, looking at biopsy samples and seeing if there's any abnormality there.
Now, when I think of looking down, and I asked a patient one time, what was it like when you had a EGD? And he said, like taking a 45-minute nap. So be that as it may, you go down through the esophagus into the stomach. Is it easy to go beyond? The duodenum is right after the stomach. Can you get that far?
Oh, sure. The scope's about 3 foot long, and it's very thin and very flexible. And you can drive it like video games. You could drive the scope left, right, and with torquing, you can put the scope almost anywhere you really wish.
Do you have to be a good video player?
I wonder the kids nowadays are going to be great endoscopists and laparoscopic surgeons in the future.
So let's go back to the symptoms. They could be anything. A bad gut, could be diarrhea, it could be bloating, it could be cramping. They lose weight?
They will lose weight if they're not eating enough. But if you're eating 4,000 calories a day and only absorbing 50% of them, 2,000 calories a day is probably enough to maintain people. But if you're only eating 2,000 calories and you only absorb 50%, then you'll be having much less calories than what you need and you will lose weight.
How's the diagnosis made as far as blood work goes? What are the blood tests? There's some specific
The main
ones.
blood tests nowadays we use is something called a tissue transglutaminase, TTG.
So it's tissue, so it must come from a biopsy?
It's actually, no, it's a blood test.
Blood test?
Yes, it is a blood test, and it's very easy, it's automated, and a result comes on the screen and you're given a number. The second test we used to use in the old days is an anti-endomysial antibody, and that's much more harder to do, much more expensive. A lab person actually has to look at these samples underneath the microscope, and it's very complicated. So nowadays, inexpensive ways to tell celiac disease is with a TTG.
TTG.
Right? And then some patients, 15% of the population, are low in antibodies. So it's always good to check the antibody levels first before you do the TTG.
Now, I remember something in training, anti-IgE, anti-gliadin antibody, something like that. Tell me about that,
Those
John.
were great back in the old days, but the modern labs are much more sensitive and much more specific, which means that if you're positive for a TTG, you have a over 90% chance of really having the disease. But with the anti-glidins or the anti-reticulin antibodies, and some of the older doctors still use those, so those just aren't as accurate because there's many false positives.
Now, if somebody has been on a gluten-free diet, they haven't had it for 3 weeks and their GI tract is doing good, is the TTG still abnormal?
No, over a period of time it will normalize. So patients on a celiac diet, patients on a gluten-free diet, Dr. Bob, they're normal. They're perfectly normal. They have no symptoms. Their intestines look pristine, beautiful. The villi are formed. They're normal. It's not until they take gluten. So if a celiac disease patient on a wheat-free diet, they don't have any findings or signs. They're perfectly normal.
If they become perfectly normal on a gluten-free diet, how much wheat does it take? How long does it take before it comes right back?
Well, how long will it take you if you're ragweed allergic and you cut the grass? Within minutes or 10 minutes, your nose is already filling up and getting inflamed and weeping. That's how long it takes for our intestines to get inflamed. You just don't notice it at that time. It just takes a while.
We're talking with Sandy Altizer, who's a dietitian. Sandy, welcome to the Dr. Bob Show.
Thank you.
Now, you're a dietitian.
Yes.
What do you teach in dietetics?
I teach celiac disease and the gluten-free diet.
So how long have you been teaching celiac disease and gluten-free diet?
About 6.5 years now.
6.5 years. Now, somewhere in there, what happened to you in 2010?
2010, after the birth of my second daughter, I myself developed celiac disease.
And what symptoms did you have?
Oh goodness. Initially it was constipation, abdominal bloating, and mouth ulcers.
So you had 3 things that you were having. Why did that make you think, bingo, I've got celiac disease?
I think it's just the awareness of the disease that I have, and for whatever reason I just started thinking about why I kept bloating and why I was having ulcers in my mouth. And it just hit me one morning, and I went to my doctor and asked to be tested.
When you went to your doctor and asked to be tested,
Yes.
what was his answer?
He said, "Why? You're not running to the bathroom."
Because we usually think that it's a disease where diarrhea is at, and you had constipation,
I had constipation.
bloating, and a mouth ulcer. So
Yes.
when you went on a gluten-free diet, having taught that for 5 or 6 years, how long did it take you to get better?
Really, within about 2 to 3 months, I could say that I was feeling much, much better. The abdominal bloating was much more controlled.
Have you cheated at all just to see if you really
Absolutely
had it?
not.
So you stay that way. Are you
Yes.
having bloating?
Not now. Only
Okay.
if I get contaminated with
And
gluten.
you talked about contamination, and that not at home. That's when you eat out and you get something.
Yes, if you're eating outside the home, it's much more challenging to control gluten because other people are preparing your food. And
Is
so
it pretty
you get sick.
easy for a patient to be on a gluten-free diet at home if they have the proper instructions?
Absolutely.
So you get the
Absolutely.
contamination when you get away from home.
Exactly.
And what's the difference in the way you feel?
Oh, my energy level is so much more improved. My mood, my demeanor, just the physical appearance and feeling is so much better.
That's really, really exciting. You have celiac disease. You teach celiac disease, and so you have to watch your children.
Absolutely.
Sandy,
Yes.
you're a great teacher. Thank you for coming to
Thank
the
you.
Dr. Bob Show. A lot of information that I didn't know you've taught me on this segment.
Very good. Thank you.
We're talking with Dr. John Haydek, board-certified gastroenterologist. We're talking about gluten sensitivity in people with celiac disease. 1 out of 200, 1 out of 250 people in the United States, much more common than we think. They have problems in the small bowel because of gluten, changes the contour of the digestive area and causes symptoms anywhere from diarrhea to constipation. Diagnosis, TTG, tissue transglutaminase. Need to know that word, TTG, tissue transglutaminase. It makes the diagnosis. You have to be on the diet that's causing you a problem when you get that test done. Is that pretty good, John?
Perfect.
Okay, now let's talk about when somebody has gluten sensitivity and you put them on a gluten-free diet, does it change their life?
If they're celiac disease patients and you avoid it, their life is back to normal. They don't die any sooner than anybody else. They shouldn't have any symptoms any different than anybody else. Off gluten, a celiac patient is perfectly normal. A celiac patient on gluten, though, may sometimes feel okay, but that active inflammation that's going on in their intestines from the chronic exposure is not good for them.
Can it change does it increase malignancy?
Unfortunately, it does make it more prone for small intestinal cancers and some other cancers also. And that chronic inflammation puts them more prone to get vitamin deficiencies, B12 and iron and vitamin D. And that chronic inflammation just isn't good for your body also.
So how do you suspect celiac disease? People are walking around with it without the diagnosis. Moms and dads and patients, what should they be thinking of to go get that tested?
Well, I think as a general rule, we really don't test patients who don't have symptoms or signs. And signs are laboratory data or physical findings. So if you feel fine, you have no symptoms, you're not anemic, and you feel good, I do not think you should be checked because there is no proof that taking an asymptomatic patient and treating them makes them better. But if they have symptoms that doesn't quite sound right to them, bowel change, bloating, gas, anemia, osteoporosis, vitamin D deficiency, I think getting checked is a very simple thing that can be done by a blood test. Now, the blood test won't make the diagnosis for you. I really think you need to see someone because you need tissue of your duodenum in order to tell you for sure. Because some people will have what's called latent celiac disease. They don't have it now, but they might get it within the future, or they have a false positive, and maybe other diseases are causing a false positive, like medications or infections.
John, I want to switch. I want to go to the fad diets, the diet that's coming out of Hollywood, the diets that we all hear about, people that change their life. They go on a gluten-free diet. They don't have celiac disease. They don't have a positive TTG. Their small bowel biopsy is normal. And yet they go on this diet and they feel better. Who should try it? What's going on?
Did you say they feel better, Dr. Bob? Well, if they feel better, then there's no reasons why they should do that. You know, there's no nutritional value that we need from wheat, rye, or barley. You know, we live in the breadbasket of the world, so wheat here is so cheap and inexpensive, but we don't need wheat in our bodies. So if someone could actually feel better, as simple as avoiding wheat, then there's no reasons why they should eat wheat.
Do you
and
think
they should avoid it?
Back when I was in training, back in the dark ages, there was an article in the New England Journal of Medicine that the most common cause of people having stomach problems ended up being an enzyme deficiency, lactase deficiency, and they found out that those people had abdominal bloating and this. Do you think that there's a diagnosis that we don't know about, or gluten could be a problem with somebody that we don't understand? What's going on?
Dr. Bob, you're so right. Nobody really knows. And we thought in our era, that was back in the old days with the lactase. But you think in our era, we would have known and be able to tell diseases. But look at ulcers. We used to think ulcers were caused by acid until we found this bacteria called H. pylori infection. So it is very possible there is another disease, condition that we don't know about. But as long as they feel better on a wheat-free diet, I compliment them for trying it, and they should continue.
And that sounds like that's solid advice. If all else fails, listen to the patient. They'll tell you what they need sometimes.
That's right.
And you're so really good at that. People that are having irritable bowel, they're people that have a sensitive gut, and sometimes we just have to guide them along. But you'd have to rule out lactase deficiency.
Yes.
You'd have to rule out celiac disease.
Yes.
You'd have to rule out other problems in the small bowel and colon, like what?
Well, you forgot another sugar that's just as common as lactose, which is fructose. And 1/3 of people with irritable bowel, they don't have irritable bowel, Dr. Bob, they have fructose intolerance. So irritable bowel, bacterial overgrowth, food allergies, just other food allergies. We think about lymphoma and celiac disease. And we also think of some rare tumors, something called neuroendocrine or carcinoid tumors. I guess I should put inflammatory bowel disease, ulcerative colitis and Crohn's in there, but those are much more severe, and usually you could tell on that.
What's the most important part, history or physical?
Oh, the history by far is much more important.
And then you've got to do the lab work. You've got to do endoscopy or TTG testing.
That's right.
Tissue transglutaminase. I want everybody to know that word so that they can talk to their doctor.
That's a long
about
word,
it.
though. That's a long word.
It is. But undiagnosed, it could lead to cancer. So in general, the gut, if it's responding poorly, you need to find out why.
That's right. And seeing a good internist or a good gastroenterologist who will listen, consider other options, and put you through tests if you need them is who you need to see.
When people respond to a gluten-free diet and they don't have celiac, I had a patient the other day and they said, well, I can eat certain types of bread like wheat, but I can't eat white bread and I feel better. What we're saying there is, you know, if that's making you feel better, let's continue that and let's see how you do.
Yeah, Dr. Bob, it's so hard. If I took a irritable bowel patient and I gave them green M&Ms and I told them to take them 3 times a day and come back to see me in 2 weeks, 20% of those patients are going to come and say, those were great, Dr. Haydek. Could I have a prescription for those? They even tasted good. Could I have some more? Those are green M&Ms. And therefore, it's always hard when you make a change with patients if it's really true or not. But overall, the adage is, if it makes you feel better, and it's not dangerous to your health, of course, if it makes you feel better, please follow it and trust your body senses.
John Haydek, thank you for coming to the Dr. Bob
Nice to
Show.
see you again, Dr. Bob.
You always teach me and teach the viewing audience, and now I'm feeling better about an irritable gut. Great show. You want to stay tuned. We're going to be talking about, you don't like to see your doctor, but what should you be listening for in your body? Red flags that wave that says you need to go see your doctor. And shingles, what causes it? Can we prevent it? And how do we treat it if we get it? I want to thank Dr. John Haydek. Wonderful discussion on gluten sensitivity. Do you have it? See your doctor. And now for questions from you, the viewer, that I think will be important to your health. Dr. Bob, my husband doesn't like to go to the doctor. I'm afraid he has medical problems. What should I be looking for? Well, it's a really good question. A lot of people don't like to go to the doctor. They say, well, I'll be all right. But it's not just husbands. Sometimes women are that way. Oh, it will go away. Well, let's look at some red flags that can be waving in front of you that tell us what are some problems. Number one would be weight loss that's unexpected. If you lose 10% of your body weight, let's say you normally weigh 200 and you lose 20 pounds over 6 months and you don't know why you've lost that weight, then that's a sign you need to have a checkup. It could be your thyroid is overactive. It could be celiac disease with poor absorption, malabsorption type problems. It could be a hidden cancer that you have. It could be diabetes that you're getting, losing weight. So if you've got unexplained weight loss, need to see your doctor. Just don't sit around and wait. Next number would be shortness of breath. When we think of shortness of breath, we think of anemia, people that have low blood count, not enough red blood cells to carry nourishment to the body, oxygen that they need. So if you're pale and your fingernails are pale and you feel weak and you're short of breath, more short of breath than normal, think of anemia. It could be your lungs. Somebody could have hidden chronic obstructive pulmonary disease, hidden asthma, hidden scarring of the lungs, where we can breathe the air in, but it can't get from the bronchial tree past the lungs into the blood. So you may think about the lungs. And the other one would be the heart. The heart has to pump blood up to the lung. If the heart is not working good, if somebody has coronary artery disease, that will make the heart perform like it's sick. It won't be pumping enough blood around. Or it may be some valve problems, or it could be inflammation of the heart or the sac lining the heart. So if you're short of breath and it's abnormal, and you know if it's abnormal, you know what shortness of breath is, and if yours is more than your next door neighbor's, see your doctor for that. If you're having changes in your joints and arthritis, is it rheumatoid arthritis? Is it osteoarthritis? There's a lot that the doctor can do for you, so don't have joint pains and discomfort. Is your GI tract giving you problems? If so, you need to see your doctor for that. So listen to your body. It will tell you if you need to see your doctor. And if those symptoms persist, I think it's time to go. So get that husband to go to the doctor, or husband, you get that wife to go to the doctor if they have symptoms that persist. Question number 2, Dr. Bob, how do we treat shingles? Well, let's talk about shingles. Shingles is due to the herpes zoster virus. It's the same virus that causes chickenpox. But herpes zoster will hide itself inside nerve endings. It sits there latent and something brings it out, where that zoster will be in dermatomes. That's a sensory pattern from nerves that are there. And you get little blisters, little painful, stinging blisters. And each blister will have a red border. It's pretty classic and could be on the chest, it could be on the face, it could be on the buttocks, it could be essentially any place in the body. If you attack it right away, there's a medicine called Valtrex, valacyclovir. And if you start taking 1 gram 3 times a day, your doctor will know the dose. For 7 days, it can weaken the attack of shingles and not let you have post-shingles pain. That's what we worry about. If you get post-shingles pain, herpetic neuralgia. There are medicines that you can take, but it's very, very difficult. Can we prevent shingles with Zostavax vaccine? Well, everybody after 60 should get it, and it decreases the chances of getting it by 50%. And if you do get it, it makes the incidence of that pain we talked about much, much less. Shingles, very common. Respect it. If you're over 60, get your shingle shot. Well, that's all the time that we have for this show. Remember, as we always say, we want you to have fun exercising. Exercising, you'll get a runner's high, you'll feel good, it'll lower stress, it'll make your blood pressure go down, you'll feel better. You'll miss it when you don't exercise. You just got to get in the habit of doing it. Get a good night's sleep, 8 hours of sleep. Boy, do we feel good when we get that good night's sleep. If you're not sleeping well, talk that over with your doctor. But be sure you go to bed in time to get 7.5 hours of sleep. 7 to 8 hours of sleep, we always say 8. Eat properly. What you eat determines on how your body is going to perform. And most of all, what is it we like? It's laughter in your life. Find somebody that you love and giggle with them and have a good time. And if you laugh a lot, you'll stay healthier.